My name is Pauline Wairimu Kamau. I work for Kirinyaga County Government as the County Director of Administration. I am a mother of one girl. I'm 48 years old, and currently I'm receiving treatment at Apollo Hospital in Delhi for breast cancer. At some time when I was discussing something with my boss, the governor of the county, and we sat down in her sitting room, and I shared with her that I had realized that my left breast was larger than the other one. I didn't take it as strongly as she took it, but the following day she told me, "Hey, have you found a doctor? Have you done the tests?" And I hadn't. It had escaped my mind. Like I didn't want to take that route, but she kept on insisting, "Pauline, can I see the results? Have you seen a doctor?" So after she put so much pressure on me, I decided, okay, let me have it checked. So I started the initial tests in my country. I received the results from our Nairobi hospital. I decided not to read the results. Probably something told me if I don't open the envelope, I will go on with my normal life. So I didn't open the envelope. I decided I'll give it to my sister, my younger sister, Judy, to read, to open the envelope and tell me what was inside the envelope. I remember she sat on a bench outside, and I could see her going through what was written there, and I kept wanting to read her face to see if she was going to express shock. I didn't want to read the report. I wanted to read people's faces. What was their reaction? If she smiled, I would think it's good. If she frowned, I would think, oh, it's bad. But I think she was smarter than me. She didn't tell me what she had seen in the envelope. She just told me, okay, we will see somebody who can interpret the doctor's recommendation. I don't understand the doctor's language, but I think she was just hiding the information from me. After the doctor went through the report, the first thing he asked me was, who else in your family has cancer? That is how I confirmed that I had cancer. It was shocking. I thought the doctor was going to tell me something different. It was shocking. I was tired. When we left that doctor's room, my sister, I left her thinking. I left her with everything. I think I stopped thinking. I just left her with everything to continue with whatever the doctors say, whatever they wanted. I stopped thinking. I just went back into a state that I don't know. But in that state, she decided, and how she decided, and how she came up with India, and how she traced Dr. Cole. She got the tickets and booked the appointments, and she just put me within a very short time, matter of days. I left my office, and she told me, "Pauline, just go to India. There is Dr. Cole waiting for you. Go straight to the doctor, and I will join you later." When I got to India, at the airport, I found someone waiting for me. Actually, I found somebody with a placard reading my name, Pauline, Apollo Hospital. And I was taken straight to Apollo. I came straight to the hospital. I remember I didn't expect that treatment would start that soon, that fast. But from the time I landed in the hospital, it's like the treatment started. I was exhausted. I was not still thinking. I was not myself. But when I met Dr. Cole, the first time I felt great relief is how he received me. He went through the papers I was carrying, what Nairobi had found. And he went through the papers and told me, "Pauline, I guarantee you, you will live. You're not dying. This is not about death." And he shook my hand and he told me, "I guarantee you, shake my hand, you will live. We will beat this cancer. Don't worry." The words that he used, I looked at him in disbelief. I was like, is this a doctor assuring me that I'm going to live, that cancer is not about death? And through the flight, I was wondering, am I going to fly back home alive, or am I going to fly back home dead? Then here, there's a doctor telling me, "You're going to live." I just came back to life. I went back to the hotel feeling very relaxed, happy. I stopped thinking about cancer. I tell you, for some moment, I didn't think about it. Went, took photos of nice hotels, sent home, told people I had arrived. I was happy. There was a whole team of about 6 who, every time who walked in with Dr. Cole, and all of them were interested in knowing how that I was faring on with treatment. Are you eating? Are you taking your medication? What are you feeling so far? Are you okay? Today we are going to do this and this and that. And I felt quite well taken care of. When the next appointment came, we did the tests. I was guided. I didn't struggle. I was guided. Dr. Cole had, there's a system. It was step by step, and the treatment started immediately. So when the first treatment, the first chemo came, I did the first chemo. Of course, the doctor had told me, you will experience this and this, but it will go. I kept those words also, it will go. Though I didn't know for how long the effect would last. Sometimes I thought they would last forever. I came to realize what he had told me, you will feel it for some time, but after some time you'll get a relief and you can do a few things. You can eat, but avoid 1, 2, 3, 4. Don't do this and do this. The second chemo came, as I'd been told, it would affect my hair. My hair fell off. I was comfortable. I was expecting it. I still looked nice with my hair. And some of the fears I had, and I think this is something that, because of the previous pictures we have seen on cancer treatment with very weak people, I expected I would be like a bone structure, very thin. I expected all that, but it didn't come. I guess, and I still know, the management that I received from Dr. Cole, the drugs I got after chemo, the food that I was advised to eat, the comfort, because I knew this was a journey that I was going to complete successfully. That comfort. I ate well, I took my medication, I slept well. Every time I came for my weight check, nothing much had changed, and I kept sending photos at home, and people would tell me, oh, you haven't changed. We all thought I was very skinny in a few days. I didn't get skinny. I didn't look unwell. Not at any single moment did I look unwell. The doctor gave me the treatment plan and told me, this is what I'm going to do. This is what is going to happen. This is what is expected of you. I had a whole treatment plan with me. I could see what the doctor was going to do next. The doctor told me, Pauline, you have to be willing to stay with us for between 4.5 months to 5 months. At that time, I quickly told my mind to accept. I didn't want my mind to debate on it and to think about home and the things that I would miss. I quickly told myself that if I am going to leave, let me stay here for the next 5 months. I will try and cope. So my sister stayed with me for some time, and then she left me going on with treatment, and later on other family members joined. When I left home, we did not inform my daughter. I have one child, a daughter, and we didn't inform her that I was going for any treatment, and we lied to her that I was going for I was going to London for 4.5 months or 5 months course. I was going to school. I think I left her with a lot of thinking to do. So she kept on probing. She could ask me, Mommy, your class, you don't have other students, and why are you always asleep? Every time I call you, you are sleeping most of the time. Don't you have lessons? At some point she told me, Mommy, why are you wearing a wig? That is when my hair fell off and I had to put on a wig. And she kept on asking, Mommy, why are you wearing a wig? And I told her, you know, Mom, I've been in this place for so long and my hair is bad. Now I have to cover it. One time when I was speaking to her, I think I flipped my video and she saw the background. And it was the background was not London, it was India. And she told me, Mommy, you are lying. You are lying. I know something is wrong. Tell me what the problem is. And she started crying. And I told her, Mommy, you know, receiving cancer treatment in India, and it is a success story, don't worry. But there was no easy way of handling it for that time. My daughter arrived a day before surgery. She was able to see Dr. Cole before the surgery. They went through again, and with the assurance of the doctor, she became a good support system to me. Encouraging people receiving cancer treatment is very, very vital, because the very first words that the doctor told me, they still keep me going. And it's the same things that I also tell people. It's not a matter of life and death, as long as it is properly managed. It's good that people go for testing, especially for the breasts. It's something that is achievable in many countries. I would advocate for for testing, whether there is something wrong or not. Just go for the usual tests. Also, something else that I discovered is the power of the mind. What the doctor told me, it's good that you remain stress-free, but I also discovered that so many people tend to listen to very much negative information, something which I decided I would not do. Don't worry so much about cancer. We have doctors, they have science, they have managed us. They will manage you. If they have managed me, they will manage you. So take it positively, live happily, and go on with your normal life. It's manageable, it's treatable. And with that, I want to thank you very much for listening to me. Thank you so much.